Mentioned earlier that there was a slightly different screening recommendation, say for those who have had a history of cancer in their family and African American men who are age 40 and above. That brings to mind the issue of risk factors. And we speak a lot about risk factors on the program and the fact that some are controllable and some are not controllable. So maybe we can talk a little bit about the risk factors that are not controllable for the moment. Let's just review those first, and then we'll talk about what we can do to try to prevent.
The ones that one can control are age.
Okay.
We don't see prostate cancer in very young men. It's more prevalent in men 50 and older. So as one gets older, they have an increased risk of prostate cancer.
Okay.
There's a 1 in 6 chance that American man, will be diagnosed with prostate cancer during their lifetime, and the risk increases as one gets older. That's the first that's not controllable.
Okay.
The second would be family history. As mentioned, if your father or your brother had prostate cancer at a relatively young age, you'd be at increased risk of developing prostate cancer, but there's no genetic testing available.
Okay.
So there's not, whereas for other cancers, there are certain genetic tests that can
And
show if you're
markers,
increased risk.
in the blood.
There is not. But it's just a matter of, if you do have a family history, it's important to come in earlier for prostate cancer screening.
Okay, so those are the things, age and race, that we obviously cannot control, as much as we want to control our age, but we can't. What are some of the risk factors, Dr. Harmon, that you think people can control, that men can do something to perhaps reduce some of their risks?
There are a lot that a man can do.
Okay.
Obviously, genetics we can't control, but diet is very important.
Okay.
Okay, a man who eats a lot of red meat, fried and fatty foods, has an increased risk of developing prostate cancer. Whereas a man who eats a lot of fruits and vegetables and eats fatty fish, by fatty fish meaning salmon, tuna, okay, things that have increased omega-3 fatty acids, will have a decreased risk of prostate cancer. For instance, a man who's born in Japan, a Japanese man, will have a decreased risk of prostate cancer than an American white man. But when that Japanese man emigrates to the United States and eats the diet that we're accustomed to eating here, his risk will increase compared to the man who stays in Japan, but will never equal the white man's here in America.
You know, and we see that, and these are topics for another program, I'm afraid, but we see that again and again with so many different types of cancers, different types of illnesses, where the Asian diet just seems to be healthier all around, but it's so easy to become quickly consumed once you move to America with our less than ideal eating habits.
And other issues that are important are obesity, which has become a major national health concern.
Right.
Men who are obese present with more aggressive disease and at a more advanced stage and are less likely to be cured. So it's important to try to keep slim.
Okay.
Something else that parallels that is exercise. There have been studies that show that exercise can decrease the risk of the development of prostate cancer. It may be its effect by limiting obesity, but also may be an independent factor.
Okay.
So diet, exercise, and keeping your weight low is important to try to prevent your risk of prostate cancer.
You know, it's a very interesting point that you just made about obesity, and it's not that the disease seems to, if I understood you correctly, it's not that the disease is occurring more frequently, but that they tend to present with it at a later stage? Did I understand that
It's
right?
a later stage and more aggressive, and there
Okay,
are some studies
interesting.
that show an increased risk of development of
Okay,
prostate cancer as
interesting.
well, but that could be a little bit controversial.
Also joining us today is Ellen Levine, who is the program director with the Wellness Community in Bedminster. Ellen, I understand that the Wellness Community is sort of a recent addition here in Somerset County, or in Somerset County, I shouldn't say here. And I know you offer a tremendous variety of services and resources for folks who are affected by cancer. Now, are you new to New Jersey? Is this a new organization? Can you tell us a little bit about that?
Sure. The organization has actually been in existence for 26 years.
Okay.
It was founded in California by a man named Harold Benjamin, whose wife had breast cancer, and he was very concerned about how she was going through her treatment experience beyond the medical component, and looking to develop an opportunity for her to be able to be with other women who were going through a similar experience and offer some support services to her. So they actually founded the organization there, and over the years, 24 locations have been started throughout the United States, and there are 3 internationally.
Wow.
So there are now 2 wellness communities in New Jersey. Ours in Bedminster was the first, and the second one began shortly after we did in Eatontown.
Oh, all right.
So,
So you're really covering two regions
Two
of the
regions
state.
of the state,
Great.
exactly. So we began a little over 4 years ago,
Okay.
and we attempt to serve 6 counties in the central New Jersey area.
Excellent, excellent. And I have to say, and I didn't mention earlier, that you are both part of the Somerset County Cancer Coalition who's supporting today's program. And as I also sometimes attend those meetings, I hear nothing but wonderful programming about what is coming out of the wellness community. And I think it just seems like such a valuable service.
Right.
Can you tell us about some of the programs you offer
Sure,
there and who
sure.
they're available to?
Sure, sure. The whole concept of the wellness community is to be able to partner with the physicians and the cancer centers and hospitals in the area to be able to complement the medical care with the supportive side. So what does that mean? We are located in a home-like setting, which happens to be a historic house. So you walk through the door and it feels very, very relaxing and soothing just to be in a place that doesn't have the sights and sounds and smells of being in the doctor's office or the cancer center.
Right.
And we offer all free programs to people affected by cancer. So the people affected by cancer would be defined as the patients. We do focus on adult patients. We don't
Okay.
serve children with cancer at this time, but the patients, who we actually call everyone participants. So the patients, their caregivers, and that could be their spouses, that could be their adult children, it could be a close friend, as well as children of people affected by cancer. And then we also have bereavement services as well. So those are the people affected by cancer who can come through our doors and take advantage of our programs.
It sounds very comprehensive in
That's
terms
our
of who
intent.
is eligible
Right,
for
right.
these.
It's a very
That's-
broad definition because, and as you
Excellent.
said earlier, cancer does touch so many people, so it's certainly a very common experience. The services fall into 3 categories
Okay.
in terms of the types of things we do. The first is support groups, the second are educational programs, and the third are what we call mind-body programs. So I'll describe them to
Okay,
you.
yeah, please do.
Sure. The support groups, I think most people have probably heard of support groups, but may not have a clear idea of, gee, how would that translate in the context of cancer. We have a variety of types of support groups, which are all run by licensed clinicians, licensed mental health professionals, not to be providing therapy, but to be overseeing that this is a setting that people feel safe and comfortable to be able to connect with others who have similar experiences. So we have groups that are cancer-specific, a few, for some of the more common cancers. We have a breast cancer networking group and a gynecologic cancer networking group. We do not at this time have a prostate cancer networking group, but we certainly know of those in the area and can tell people where they might be if they needed to find that out.
Okay, so you can also serve, excuse me, as a sort of a clearinghouse for
Exactly.
information for what you may
Exactly.
not provide. Okay,
Yeah.
great.
I have a long background in oncology. I'm a social worker, and so I know a lot about the resources in the community.
Great.
So our groups, as I said, some are cancer specific, many are more generic for people going through active treatment. We have groups. We have groups for people who have completed treatment. We call those our survivorship programs. For people who have completed active treatment anywhere from a month ago to 2 years ago, who are really in this in-between phase. They've looked forward for so long to completing their treatment. The treatment is over, and they're in a new phase of their lives. We often call that as a new normal, and adjusting to that new
I can
normal and
only
how that
imagine.
feels, to be able to be with others who are going through that transition, their friends and family who have been usually often very supportive. Often those folks sort of don't recognize that there's still a need for support, so to be with others who are in that phase, to be able to both have the opportunity to talk, but also strategize about lifestyle changes that people
What do we
might
do
want to make.
next?
Some of the things that the doctor was mentioning in terms of exercise and diet, those are components of those survivorship support groups that we run.
Okay.